Anybody who's had a migraine will tell you that they're usually so fierce that they really just make you want to try to find a quiet place to hide. I'm Dr. Brandon, owner of Physio here at Body Mechanix Physiotherapy, and today we're going to talk about several ways that you can naturally ease a lot of the underlying causes of migraines, especially if they happen to be coming from the neck. So first, how to tell if your migraine might be coming from the neck. So if I notice that my migraines tend to come on a little bit later in the day, specifically, I may notice a pattern where I'm tender to the back of the head. My pattern is often it's going to be coming up and over the back of the head. Sometimes it'll even be behind the eye. Now, a lot of times with migraines, a lot of people tell you that they deal with visual issues, so they'll see kind of blurring or bright lights will be painful. And that's also true for the migraines that are actually better known as cervicogenic headaches, basically headaches that start coming from the neck. So in this post, we'll talk a little bit more about just some ways that you can start to ease, really, like I said, the underlying causes for those migraines and headaches. All right. All right, number one is going to be from our office chair or from our chair at home. So it's going to be our posture reset. Okay, so we're sitting here, typing away, doing all the stuff that we have to do. Maybe we're kind of in one of those soul-crushing Zoom meetings. All right, so what I want you to do is I want you to lift your chest up, arch your spine a little bit, kind of arch it about as far as it goes, and then we're just going to come out about 10%, and we're going to try and hold that there for about the next 30 seconds. All right, so about 2 to 3 reps of that. So remember, we're going to come arch our back. We're going to hold back off about 30, back off of just about 10%. We're going to hold that there for about 30 seconds. All right, let's do that just about every hour. Okay, so kind of set a timer to do our posture reset every hour. All right, up next is our reset for our text neck, for our end of the day headaches, for our sometimes even shoulder stiffness or pain. Okay, so we're gonna come here. So we just finished up doing our posture reset, and what I want to do is I want to give myself a double chin. Okay, or pretend like maybe I have somebody like with really bad breath kind of coming in close, and basically I want to come back with my neck and out. I want to slide it back and out. All right, so now some keys to winning with this one is that I only want to go to the edge of my stiffness, to the edge of my ouch. If I have an ouch when I start and I keep on going through it, I'm actually probably going to make things worse. It doesn't mean that movement isn't the right movement for you. It's just a matter that your nervous system, your alarm system isn't quite ready to handle it just yet. And so with all of these, we just want to go to the edge of our stiffness and not go through them. All right. Up next, we're going to talk about what to do for helping our low back stiffness. All right, and so for our migraine release, and this also really works well for really anything if you're having pain kind of through the back of your head, we're really just going to use either a tennis ball or 2 tennis balls. Sometimes it's a little bit easier to have these be in the right place by putting them either like in a big sock, something that helps keep them together. But basically, you're just going to find a wall with either that single or the double ball, and we're really just going to put some gentle pressure to the back of your head, down your neck, and really to the top of your shoulder blades. One of the things that they've found is that there's a muscle pretty much right there at the top of your shoulder blades that is usually really involved in any sort of neck-based headache. All right, so for our taping for posture today, we're going to do a basic A-taping technique. This is going to be one it might be a little bit harder to do on your own, but getting the 2 strips that we're going to be put on the side of the neck will be something that you can do. In this case, it's usually better to start face down. If you don't have a treatment table, usually having a pillow underneath the head brings your chin into that tucked position and works on straightening out your spine. Because what we're going to use the tape for is as a cue to let you know when you're starting to slouch and slide that head forward. So for our taping today, we're going to start most of the way up on the neck, but I'm not going to stretch the tape out as far as it goes. I'm going to take this out to about a 50% stretch. And so when you're applying tape, we want to make sure that we, in this case, get all the hair out of the way. I don't want to have any stretch right as I started off, so I want to have about an inch with no stretch on it. I'm going to go ahead and pull this out to about 50% tension, and then I'm just going to apply this down inside the shoulder blades. Now, again, this is going to be one that might be helpful to have a friend tape, but basically we're going to pull this down between the shoulder blades and basically stop when we run out of tape. We're going to smooth it out, make sure that the adhesive is binding. In this case, we have one section of our A tape on. So for the rest of our tape, we're going to do the same thing. In this case, we're going to, again, make sure there's no stretch. It's going to come down just inside this shoulder blade here. And this is the part where it helps to have a friend. We're going to go ahead and go between the shoulder blades so that when we slouch, our shoulder blades tip forward, our head goes forward, that it gives that the stretch of the tape gives us an idea that we're coming out of position, tells us it's time to take a posture break, we refresh, and we're able to fix it. All right, so the tape keys with this, we don't want to go any more than about a 25 to 50% stretch. We don't want to stretch it all the way out. If you happen to notice any itching or burning, as it's on, go ahead and immediately take it off. That means that you might have a skin sensitivity to the adhesive in there. And the real key isn't taking it off. Okay, so in order to make it as pain-free as possible, go ahead and make sure you do that after a hot shower, which basically gets the adhesive nice and gooey and makes the tape come off nice and easy. In this case, this is the Rock Tape Extra Sticky, and typically I found this goes for a good 3 to 5 days. And also allows you to sweat in it, swim, and take showers in it without it losing its stickiness. And so there you have it. Hi, and welcome to TallahasseePT.com, home of Body Mechanix Physiotherapy and Fitness. I'm Dr. Brandon, the owner and lead physio here at Body Mechanix. And I just wanted to start off by letting you know who it is that we help and then how to best use this site to get the information that you're looking for.